Kane again, and what we're doing for this patient is the general lifting, firming of the buttocks. So when she stands, you can see the cellulite or the relaxation of the skin. What we want to do is firm the skin up so it acts more like a mesh and tightens in this direction. We'll start with the visible areas of the thigh buttock region and lift and mesh it, but at the skin level. We're not going to use today the deeper sutures or the barb sutures which lift at this time. We're going to use more of a compression garment effect on the skin by forming collagen. And we'll see when we're done. I'm putting the second line of sutures in. As you can see, this is creating a lattice or matrix effect along her posterior thigh. And in so doing, over the next 3 months, we're going to see an improvement because of collagen formation in her skin firmness, smoothness, and lack of laxity. You can't see it, but it's right there. You can see it's right at the dermal level. It's through the skin and not through the subcutaneous tissue, which is really a revolution in the ability to create this collagen production. These are my horizontal matrix PDO threads. They are going above the buttock banana roll crease line, and the reason for that is we also want to toughen or firm the area of her stretch marks in this area, a little bit of laxity in this area, and that by itself will create kind of a band corset pushing up on her buttock as it tightens. These are smooth PDO threads that have been placed into the dermis as a horizontal process of the matrix that we're making. Later we'll put these in the vertical direction, but now we're going to take them out. So it's a very impressive way to show how the threads go in and the needles come out. So after the PDO has started to form fibroblasts, collagen, it will peak at 3 months, and since the suture will stay for 4 to 6 months longer, it will continue to develop collagen for over a year. This is really a mainstay problem for all women. The tissues of the buttock become thinned out, and what we're doing is creating, if you will, a PDO matrix or lattice so that it will form collagen based on normal healing process. The healing process takes 3 months for the beginning of collagen formation at about 10 to 14 days, and it peaks at 3 months. But because these threads have been manufactured in a way with PDO, polydioxane, they will stay and stimulate collagen formation for a longer period of time. So this patient has been with me 20 years. She started with me when I had interest in contour threads for the face. At that time, she will tell you what I predicted, and here we are today, finishing up her thighs. We did her buttocks, and who knows where we'll go next.
So yes, I've been with Dr. Kane for 20 years. We did a thread lift that long ago, and we had a conversation when we were doing that about the future, and Dr. Kane said I would really, really like to see thread lifting done over the entire body. So here we are 20 years later. I've done my buttocks today, with Dr. Kane, and Lori did my buttocks today. I did my thighs today and knees. I'm so excited to see what the results are. I'm almost seeing results as I'm sitting here 10 minutes after the procedure.
And how was the discomfort?
Very little. There is occasional, little ouchie here and there, but very tolerable. And believe me, it'll be worth any kind of little small pain you might feel today to have.
And it allows you to drive home?
I can drive home today. And for me, just being able to wear shorts again is so exciting. I'm looking forward to the summer.
Thanks so much.
Yes.